Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 41 new cases of COVID-19 in Windsor and Essex County. 18 are close contacts of confirmed cases, 9 are community-acquired, and 14 are still being investigated. We have had 14,844 cases since the beginning of the pandemic. 13,978 cases are now resolved, and 457 people are active at this time. We have 511 preliminary or confirmed variants of concern identified in Windsor-Essex County, with 430 cases having the UK variant. 121 of our active cases have the variant. Please remember that if you have symptoms of COVID and have been tested, you must self-isolate. While you are awaiting test results, you, along with your household contacts, must isolate until a negative result is received or an alternative diagnosis from a healthcare provider. Household members are required to stay at home except for essential reasons such as going to and from work or to a medical appointment. High-risk contacts, such as household members, must be retested on day 10, even if a negative result was obtained due to an earlier test. 12 people are currently in the hospital and 8 people are in ICU. Our community has lost 409 people to COVID. There are currently 7 active outbreaks in Windsor and Essex County, 6 in workplaces and 1 school outbreak. A total of 131,981 doses have been administered to Windsor-Essex County residents for vaccines. 119,275 people have received at least 1 dose of a COVID-19 vaccine. Regarding our mass vaccination sites, we are currently vaccinating people 60 years of age and older across all vaccination sites. In addition, those 50 years of age and older living in one of the identified hotspot postal code areas can be vaccinated. These neighborhoods where postal codes begin with N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. When you attend your appointment, please bring proof of address, whether it be a driver's license, current utility bill, or other bill. We are pleased to announce that the Chamber of Commerce is supporting the transportation needs of residents living in hotspots to ensure all residents can attend a vaccine clinic. Many partners have come together to provide this service, including Green Shield Canada, Hydro One, Sun Life, Rotary Clubs of Windsor-Essex County, and Windsor-Essex Catch the Ace. Transportation will be provided by Vets Cab in Windsor and Sun Parlour Taxi in Leamington. In addition, Transit Windsor is offering free bus service to mass clinics in Windsor. Please note that whether you are booking online or by phone, the available appointments are the same. The call center does not have access to appointments outside of what you see online. If you are booking online, please go to wevax.ca, or if you need assistance, please call the call center at 226-773-2200, and someone will be able to help you. We would also like to remind residents that beginning tomorrow, people 40 years of age and older may be vaccinated at one of the participating pharmacies in Windsor-Essex County with AstraZeneca. We will continue to work on vaccinating our residents through as many channels as possible. For general inquiries regarding vaccination, please call 211. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us again. Starting today on our website, you will notice that we are reporting the preliminary report on the subtype of VOCs. Previously, we were waiting for the confirmation before reporting it to the community. We hope that this will help everyone understand the different VOCs circulating in our community. The Provincial Case and Contact Management Protocol was updated to include the VOCs, and specific measures are put in place to contain the spread as quickly as possible. What this means for you as an individual, if you are waiting for a result, if you are symptomatic, all household members of symptomatic individuals are now required to quarantine until the symptomatic individual receive a negative test or an alternate diagnosis from a healthcare provider. If you are positive from a point of care testing by public health unit, we will initiate a full case and contact management to contain the spread as quickly as possible. All VOC cases and their contacts are prioritized for follow-up at the health unit. If you were previously positive, you still need to self-isolate following a new high-risk exposure to prevent reinfection. If you are a contact, we are now using a lower threshold for classifying contacts as high-risk contacts and requiring you to self-isolate based on the risk assessment. We'll take into consideration duration of contact, mask use, use of eye protection, the place where you are, the ventilation of that space, etc. Retesting of high-risk individuals, high-risk contacts at day 10 if initially tested positive on day 0 to 6 and was negative. We also require the household members of a high-risk contact, such as school high-risk cohort, to stay at home except for essential reasons while the contact is in isolation. These measures are important to identify a VOC cases early, even before the investigation starts, and helps to prevent further spread of VOCs in our community. Now, switching gears, Dr. David Williams, Ontario's Chief Medical Officer of Health, announced this morning that starting Tuesday, April 20th, 2021, Ontario will offer the AstraZeneca vaccine to individuals aged 40 and over at pharmacy and primary care settings. As many Canadians are contracting COVID, it is critically important for everyone to get the first vaccine available to them. The safety and effectiveness of these vaccines are carefully assessed and monitored all the time, and will continue to report any adverse event, any high-risk situation to the public immediately. As an example, the United Kingdom used AstraZeneca vaccine predominantly in their country, and their case rates are now significantly lower than many countries of the world, including Canada. It is now standing at 6 times lower than what Canada's case rates are at this time. At one point, their case rate was 4 times higher than Canada in the past. So clearly, these vaccines are highly effective in preventing the spread and the hospitalization and severe outcome of this COVID. So please take the first vaccine that's available to you. If you have any questions or concerns regarding the safety and effectiveness of these vaccines, please continue to visit credible website for accurate information or talk to your healthcare provider. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
To clarify, the new rules for testing, if somebody in your household tests positive and you go and get tested and you test negative, you're required to get tested again at day 10 before you are considered no longer a threat or a concern for possible transmission?
So if you are identified as a VOC case, and what happens is sometimes individuals just go and get tested at 2 to 3 days after the initial test, which could be a negative because of the incubation period. So especially in the VOC cases, we would want everyone to get tested again at day 10. If they were previously tested in the earlier time and were identified as a negative. So just those individuals will be tested again. But for someone who was never tested, we expect them to get tested 7 days after their 7 days after the contact from the case.
Okay.
Thank you.
Any questions from the Windsor Star?
Good morning, Doctor. Good morning, Teresa. Recognizing that the province, the Ministry of Health is supplying pharmacies with doses of the AstraZeneca vaccine directly, do you have any indication that the supply of vaccine to our regional pharmacies will be increasing?
We know that the ministry is providing the vaccine directly to the pharmacies, as you indicated, and that they have received increased amounts, like extra vaccine, as they are, going through their own inventory. Right now, other than the initial about 1,000 doses we received for primary care providers, we haven't received any additional AstraZeneca vaccine, but the ministry is providing pharmacies with extra, so they seem to be monitoring that.
So if we were to be interested in knowing how many doses were going to regional pharmacies. Would we have to go directly to the Ministry of Health for that information?
Yes, they would probably have a better overview. We do have the list of pharmacies on our website and information, but we are tracking it internally, but the source of that good, accurate information would be with the ministry.
And just looking at the variant cases, I know it was on Friday, there were 380 cases, and now we have 511 variant cases. Given that you're changing the testing protocol for close contacts of variant cases, are they on the rise here?
Well, we did report last time in our epi summary that anywhere between 30 to 50% of our cases are now coming back as variants of concern. And that's what's driving the number. And that's why you're seeing some of these fluctuations, because when we have a variant case, the immediate household contacts or close contacts are all coming back positive and then driving those numbers up. So that's why it's important for us to recognize that with the variants getting foothold in our region as well, and also coming from community spread, it is important that we all follow all the public health measures, including the changes in the case and contact management, and even as a general public, when we are out there, how we are conducting ourselves and keeping ourselves safe is important. It is on the rise, and we can do our best to follow the public health measures as best as possible to contain the spread.
And finally, are the hospitalization numbers that the health unit presents every day local residents in hospital?
I think what you will see today, it should include the two transfers that happened. I don't know if there were any others, but they should be included in that number, because the way they are reported in the provincial bed capacity usage, so it doesn't make any distinction whether this person is from here, from our region, or from outside of our region.
Okay, thank you.
Any questions from AM 800?
Teresa, just in regards to the total doses, and I believe you mentioned this before, just looking for clarification, the 131,981 that you mentioned today, does that include AstraZeneca as well?
Yes, that would include everything that is being administered in Windsor-Essex County, so it would include the pharmacies.
Okay, perfect. Sticking with the vaccine, we got a couple emails, calls. I guess people are concerned, it seems like, in regards to the 16 weeks and with the amount of vaccine. I know you touched on this before, but what is your message to the community? If their appointment is, just say 16 weeks from today, will there be, I guess, their vaccine waiting for them?
So we are, people that received their first vaccine early in, I guess it would be like in March and the, you know, in the earlier vaccine clinics, we are now working on booking second doses for people. So we'll use our allocation, whatever we're given by the province, to start populating the second doses. So that could impact the ability to administer first doses, but we'll be, anyone who's received their first dose, we are making plans for them to receive their second dose. You know, there have been lots of changes and with deliveries at times, but we will be working with the information that we know to make the best decisions for our community and working on the 16-week, the 4-month interval for all of the vaccine that we've given, except in very specific circumstances where that interval has been shortened due to a medical reason.
And finally, once again for you, Teresa, how has the booking gone? I went on the website to have a look, and I noticed that there's some spots that are, some locations that are fully booked and other spots that are not. How has the booking process been for the most part? Are we pretty much full in Windsor-Essex daily?
So we have people looking at the booking as well, and we have those conversations all the time to determine how many how many spaces are available. So on the weekend, we did increase accessibility for people with high-risk medical conditions. As well, we asked people that are deemed a primary essential caregiver for someone who has a highest risk medical and a high risk medical condition, for those people to book as well. And there's a little bit of availability. I wouldn't say there's a lot on the website. As well, we're reaching out to some essential workplaces to invite some people to start registering as well. So we have a little bit of space, but we're having discussions all the time to make sure that we're booking as many people as possible and using every available space. And in some cases, we've increased the capacity to vaccinate at a clinic, and we'll open up spaces as we do that. So if we increase, the timing of a vaccination, we can open up spots in our booking system. So we're watching it all the time, but I did look at it as well, and there might be a few spots available for tomorrow. So we would encourage anyone who's eligible to go on, use any channel that's available in Windsor-Essex County to get your vaccination.
Thanks, Teresa.
Any questions from CTV?
Yes, good morning. With the age change for AstraZeneca, how do you reassure residents 40 plus that it is safe?
Well, I think the various reviews that came out from UK and mainly from Europe have deemed that the risk for having these blood clots are much lower than the risk of contracting COVID and the complication that is associated with COVID. And some of these rare adverse events are truly rare in the setting that it can happen with any type of medication or anything that you're taking right now. But when you're looking at the overall benefit, the benefit clearly outweighs any of the risk that is associated with the vaccine. And that's a reassurance because Canada has a robust system of monitoring the safety of these vaccines. And we continuously review all the information that comes to Canada from not only from the local data, but also from international data. And we are committed to ensure that to share the information that's available. And all of those things are currently happening to make sure that the medications, the vaccines that are available in Canada meets the safety standard that is important for our residents to receive the vaccine. So all of those things are in place, and we'll continue to look at the data, look at the evidence. And as I mentioned, even UK data, that they use majority of their vaccine was just AstraZeneca. And with some cases, and they're still now, as I reported, their case rates are now 6 times lower than what Canadian case rates are, which is significant. And at one point, their case rates was 4 times higher than the Canada. So there are some pros and benefits to getting the vaccine early. And as we are seeing that more and more people are getting sick and they're staying sick for longer, it is important that everyone should get the vaccine, the first vaccine that's available to us. And all of these vaccines are continuously monitored for safety, and we'll continue to report if there's any concerns from these vaccines.
And do you have an update on how the vaccinations went for inmates and staff at the Southwest Detention Center last week?
Yeah, I'll pass it on to Teresa.
I believe it went well. We are still vaccinating some of the staff that would be asked to go to a vaccination clinic, but I believe it went well. We were there on Tuesday and Friday, and I think it went well. I didn't hear anything different.
Okay, great, thank you. And Dr. Ahmed, do you agree with the provincial government's decision to reverse the playground closure? And what's the situation like in Windsor-Essex? Do you feel like it's an area of transmission here?
Well, we know that the indoor transmission risk is much higher than the outdoor transmission risk. The risk from these outdoor spaces is depending on the type of engagement, I can understand the initial decision when it came out was to prevent people congregating together, not at a physically distant space, and even engaging in contact sports, which could be a risk for transmission in the region. So I think it is important that when we are engaging in any type of physical activities, we have to be careful that who we are engaging with, what type of physical activities, personal exercise, personal outdoor time, is sports that you are physical activity that you are doing with your own family. These are all okay. But if you are physically getting in touch or having any kind of contact sports with anyone who doesn't live in your household could be a risk. So I think those are the important distinctions. So making sure that public is aware of these nuances is important, rather than using a blanket approach in one way or the other, either to shut it down completely or to open it up completely. I think it just poses those risks. So we need to make sure that when we are out, all these activities should be limited to our household members only. And I think that's been very clearly stated by everyone.
And is it something that you'll be keeping an eye on as far as if you do see areas of concern with playgrounds that you would consider putting your own order in place?
Well, we'll have to wait and see. We definitely want to encourage people to spend more time outdoor, just from a physical fitness perspective and also from their mental health perspective, especially if the weather is nice. But we definitely don't want to see any high-risk activity, but we'll keep a close eye on it, and we'll see if there are anything that we need to do locally.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Are vaccinations continuing today for farm workers in Leamington? Wondering also how many were vaccinated yesterday?
So yesterday we vaccinated, I believe it was around 440 people working on the farms, and vaccinations for farms will continue all this week and into next week as well. So we're booking all of the as many as we can, and it will continue today at the Nature Fresh complex in Leamington.
Thank you. In other areas of the province, we're hearing about an alarming rise in the number of hospitalized and admitted to ICU COVID-19 patients who are pregnant. Are we seeing anything like that locally, any rise in COVID patients in hospital who are pregnant?
Not to our knowledge at this time. I think we'll still have to wait and see. I haven't heard anything.
Okay, thank you. And what do you think about pushing that group up in the vaccination priority, given what we're seeing in other areas?
Well, I think some of these priorities definitely are coming from the province, and after carefully weighing the risk and benefit, we still have limited data on this population. And based on what we know, the guidance is there, and any of these further recommendation would come from NACI or from the province at this time. I can't say that we have to do that right away, but we'll have to look at the data before we make that call.
And with regards to direction from the province, things have changed pretty rapidly in the last couple of days. Is any of that change posing challenges for the health unit? Are you concerned that people might be confused about what's allowed and what's not?
Well, there's always this risk, because when you're putting in new restrictions in place, sometimes people don't know how to follow these restrictions. The bottom line always go back to some of the basic public health principles. So that's what we continue to reinforce. And that would never change in terms of some of the other activities that goes in terms of where you can shop, what you can do, and what you can do in any specific space. Those continues to evolve with the changes based on the case rates that we see across the province. So it can be challenging, and that's why we encourage our residents to visit our website. We try to post the most up-to-date information as quickly as possible to inform our residents, and we take the opportunity to update the information as quickly as possible if it's released by the province, and they can always reach out to us if they have any specific questions.
Thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Not a question, just a request if possible. You know how today we're announcing 41 new cases? How many of those are variant? Could we get that number moving forward? So for example, 41 cases, 10 of them, for example, are variant cases. Would that be possible moving forward?
We don't get the variant report the same day. It is at least lagging 2 to 3 days. And we can make that distinction that out of these 41, how many of those are variants. It'll always be late. But the assumption as we continue to work with all these cases is they should be treated as variants until proven otherwise. And that's why some of these changes to the protocols and guidelines are there.
Thank you.
Any additional questions from CTV?
Yes, just one more on the variants. Do you happen to have a breakdown of the severity of these cases? For example, how many people with the UK variant have been hospitalized, that kind of thing?
I don't have that breakdown, and I don't think that we can track that, but I'll definitely check with my EPI if we can find that information.
Okay, thank you.
Any additional questions from CBC?
Yes, Dr. Ahmed, you said in the past that this shutdown could be an opportunity for us to get our case numbers down and come out of this in a better position on the color-coded scale. But we've only really seen our case numbers increase at that time. Do you feel like that opportunity has been lost?
I don't think so. I think we still have the opportunity to bring it down. As we reported 40 cases this morning, those are some of the indications that there are some silver lining to what we're seeing right now. And if we continue to all follow the same public health measures, we can be in a better position. I think with some of the increase that we are seeing, maybe those were initial trends and concerns that was from before the shutdown initially. So we'll have to wait and see. But I truly hope that if we follow everything as we've been talking about, we should be able to contain it. And I truly hope that. And I hate to be wrong, but we'll see what the next few days show. But these numbers today, this morning, were really encouraging to see that we're not going down into that pattern of increasing case rates every day. And let's just hope it stays there that way.
Thank you.
Thank you, everyone. Have a good day.